To the College of Medicine, Nursing and Health Sciences, academic staff, graduates, Janif, the Chancellor and Chairman of Fiji National University.
The Chancellor of Fiji National University, Mr. Iqbal Janif, the Vice Chancellor of Fiji National University, Professor Nigel Healy, the Dean, College of Medicine, Nursing and Health Sciences, Dr. William May. Dr. William May, may I once again congratulate you. I think I was one of the first ones to congratulate you in October when you were appointed to your position. But I think I'd also like to congratulate you for being titled Homegrown and Fijian Made. So congratulations. The Registrar of the Fiji National University, Ms. Sarita Harish, Deans and Directors of Fiji National University, a special acknowledgement to my honorable colleague from the Kingdom of Tonga. I see you there, Honorable Saya. Thank you very much for being here. Other special and invited guests, sorry I don't have a list, but a special acknowledgement for you being here this morning to be part of this very important event. Other distinguished guests, parents, children, ladies and gentlemen, Assalamu alaikum, Nisambula Vinaka, and a very, very good morning to you all. Indeed, it's a very, very good morning, and I'm blessed and honored to have been given the opportunity to join you, to join with all of you in congratulating and celebrating not only the success of our newly graduates, but the success of Fiji National University, and of course the new graduates in medicine, dentistry, nursing, allied health and public health. So thank you very much. Again, I'd also like to thank the College of Medicine, Nursing and Health Sciences, because the college in various guises has played a key role in training, developing and mentoring health workers from Fiji and across the Pacific since 1885. I'd also like to acknowledge our regional guests and our regional graduates here this morning. Ladies and gentlemen, the programs offered by the Fiji National University reflect the unique needs and aspirations of the Pacific students. And they produce graduates whose skills are tailored to the particular challenges of working in our Pacific context. At the same time, the college courses are recognized as being of equivalent standing to those delivered by other leading institutions around the globe. As a result, we all can be confident that our health professionals and the graduates here with us today are equipped with the skills and knowledge needed to provide truly world-class healthcare to our people and our patients. The college is both innovative and dynamic. There can be no better example of that than the recent introduction of provisions for lateral entry into the MBBS program. That initiative, which stemmed from a request by the government of Fiji, gives those with relevant degrees an alternative pathway by which they can enter the prestigious MBBS program and begin their own journey towards fulfilling their dreams of becoming a medical doctor. I understand that a further lateral entry program for nurses wanting to upgrade from a diploma in nursing to a Bachelor of Nursing will also be available from next year, as mentioned by the registrar. Such programs, students, ladies and gentlemen, in both medicine and nursing are excellent examples of the ways in which Fiji is seeking to establish more modern and flexible approaches to developing our health workforce. We are indeed recognizing and responding to the fact that old models of professional training and development may no longer be the best option for our young people today. We are acknowledging that our young people may not be content simply to gain a qualification and consider their education to be complete. We are providing opportunities for learning and development to be an ongoing process which extends throughout a person's career. Now that is essential in the modern world where society and technology are changing at an unparalleled rate and skills learned just a few years ago may quickly be outdated. Those of you who are graduating today will see unimaginable changes in our world during the course of your professional careers. Now that should be both exciting and challenging. However, today, this morning is a time for you to acknowledge how far you have come and celebrate what you have achieved. And as you do so, you will also want to acknowledge the support you received from your parents, your families, your friends, and your loved ones. While it is you who have studied hard, completed your projects, assignments, submitted your reports, and passed your exams, I'm sure each one of you has been helped in many different ways by those around you, including your friends, families, your tutors, and your other colleagues. They may have helped to fund your studies. They may have provided a shoulder for you to cry on and encourage you to persevere when times were hard. In some cases, I expect they may have stopped your younger brothers and sisters interrupting your studies, simple things like that, so that you concentrated on your studies. Or simple thing when one of your friends supplied you with coffee when you were studying late into the night. These are special things that you need to sit back and reflect, because these are the things that help us to achieve a lot in life. There may be simple gestures, but I'm sure you will appreciate that those gestures have put you to where you are today. And so today, I would like to thank them on your behalf, and I'd also like you to thank them in your own special ways. Some of you students may have studied under the National Topper Scheme or our Tertiary Education Loan Scheme, while others from neighboring countries may have been supported by the governments. These are the times to be appreciative and be thankful for all the support that you have received, be it financial, be it moral. The Chancellor mentioned working with the Fijian government. We're indeed committed to working with your university now and in future to ensure that we, as you said, create a smarter and a better Fiji. Some of you students who are graduating today may have already worked in the health sectors or may be coming from the working sector. Some of you may not. So the experience that you gained while working and studying should help you become a better medical profession now. For those of you who will be entering the job market as new graduates, I'm sure you are aware of the challenges that await you. And I know you are prepared both to handle those challenges. No matter what your backgrounds might be, your graduation today provides you with a basis to build a successful career and to contribute to the well-being of your families, your communities, and the nation and your region as a whole. Your career may take you to new places, new towns, new cities, to the remotest part of your countries. Some of you, I'm sure, are looking forward to that. Some of you would be dreading posting to your rural areas, but I challenge you to take that up and find satisfaction in the job, no matter where you are, if you do it with full commitment and dedication. Dear students, you may also have opportunities to use your skills to work overseas. There are many FNU graduates, I am told, who have gone to practice overseas. While we are always sorry to lose skilled health professionals to other countries, we also recognize the attractions and the value of international experience. And I'm pleased to know that many who spend time overseas eventually return or wish to return to Fiji and allow us to benefit from their experiences gained from other health systems. So wherever you work, you must always seek to maintain the highest standards of professionalism. That doesn't just mean clinical expertise and technical know-how. It means maintaining the fundamental sense of humility and the willingness to serve that has been a constant theme in clinical practice for centuries and centuries. It will not surprise you to know that I often receive complaints from people who experience our health system. And I do take these complaints very, very seriously. But I also recognize that there are many more people whose experience of our health system is entirely positive. Sadly, few people feel the need to contact me personally to express their satisfaction and, of course, their dissatisfaction as well, which I'm sure we'll agree is only natural. When I look at what drives many people to complain, a constant theme that comes to my mind is communication. And I'm sure your studies have equipped you with those skills to communicate with your patients. That may not in many cases be an obvious issue, but so many criticisms, whether they relate to long waits to staff who are thought to be unhelpful or uncaring, can be traced back to poor communication. Waiting to see the doctor or nurse does not seem so bad if the reason for the wait can be explained. And I'm sure when you enter the health sector, you are prepared to deal with this. While we are too busy or confronting a difficult, argumentative patient, it can be all too easy to appear abrupt. But I urge you to stay calm and be respectful, however how hard that situation might be. So I would suggest, and I would say, that communication is essential to turn your academic success into clinical experience. And that's the major message I'd like to leave with you. On that note, I shall close. I know you're all eager to be conferred with your degrees, diplomas, and your family is also excited to see you, for you to be awarded with that. So I'd just like to close with a few simple remarks. A legendary American poet, Maya Angelou, author and a civil rights activist, said, I quote, "They may forget your name." And when I said they, in this context, I'm referring to your patients. They may forget your name, but they will never forget how you made them feel in your presence, unquote. So I'd also like to say congratulations once again to all the new graduates to the University of Fiji for this achievement, and for all the parents. I'm sure you're all proud. You have traveled from far and abroad to be part of this graduation ceremony. I'd also like to leave you with this very important quote that I normally quote from Mother Teresa. And this is very applicable to our lives, whether you're a medical professional or whether, just being good people, okay? And I believe in that, and I actually draw my strength from the words of this poem. Let me read it for you in closing. It says, "People are often unreasonable and self-centered. Forgive them anyway. If you are kind and helpful, they may accuse you of having ulterior motives. Be kind anyway. If you are honest, people may cheat you. Be honest anyway. If you find happiness, people may be jealous. Be happy anyway. The good you do today may be forgotten tomorrow. Do good anyway. Give the world the best you can, and it may never be enough, but give your best anyway. For you see, in the end, it's always between you and who? It's never between you and me. It's always between you and somebody up there. So believe in that. So be good, be kind, be forgiving, be happy, and give the world the best, even if it may not be enough. And especially in your career and your profession, you will continue to receive criticisms. Positivity may come not as much as you would expect, but be ready for that. Be happy, be compassionate, be committed, and be proud of who you are and be proud of what you have achieved. So with these words, ladies and gentlemen, parents, staff of the Fiji National University, and dear graduates, congratulations once again. And I know it is time to celebrate, so please bask in the glory of the achievement that you have. Have a wonderful Christmas and have a blessed New Year. Thank you very much.
Miriam Amelia Singarana Wara Rotumbiao, David Chirokakau. Asena for the Master of Public Health, Angelique Thomas. Elizabeth Menon. Tolototo Levi